Hi guys, welcome to my vlog. I'm coming at you from my room in my apartment. So I'm going to be discussing my learning plan in this video log. Essentially, my learning plan was to learn how to do specialized wound care for my patient in the complex continuing care unit. He has severe giant plexiform neurofibroma. And just to give you a rundown of what that is, a type of neurofibroma, so it's a tumor that attacks the peripheral nerves. It is considered benign, but it is especially giant neurofibroma. It's a really hard condition to live with. His tumor probably adds at least 100 pounds to his body, give or take, maybe even more. It's quite heavy and it causes a lot of damage to the skin, to the mucous membranes, and it's difficult to treat because it does cause so much damage for him, and it is a very specialized wound care routine. So that was my learning plan. So in terms of learning questions, my questions included, are there any precautionary or infection control measures I must take before examining or cleaning the wounds? Will the treatment be painful for the patient? And due to the gravity of the condition, will this wound care permanently prevent these wounds from returning and or future wounds from developing? So to answer those questions, the first one about infection control measures I need to be taken when examining and cleaning the wounds, absolutely. He does have a lot of purulent drainage from his wounds, and a lot of those wounds are quite large. So not only using gloves, even just to examine when taking off the dressings, but also gowning up. My patient also tested positive for E. coli, so I had to take those infection control procedures anyways. Will the treatment be painful for the patient? In terms of my patient, he managed the pain very well. The treatment that was used for him is a 30-minute to hour acetic acid, so vinegar, and saline water solution, so 1-to-1 ratio. So that would soak on his wounds. I usually left it on for an hour because the longer the better. And then after that, we would dress the wounds using a saline water soak. For some of the smaller ones, but for the larger tears in his skin, those would just be with the Kerlix gauze. We'd leave that on the wound, make sure it's properly packed, but that it's not too tight in the wound, and then we'd use the Tegaderm pads to stick it on, and then abdominal pads as well, since it was a really large wound, so those would stick on. For the smaller ones, we would use alginate gauze, which was cut into smaller pieces, put on the wound, and then again Tegaderm to cover it and keep it on. Whenever I asked him if he was in pain while we were doing this, especially with the acetic acid soak, because it is fairly acidic, even though it's diluted, I would keep checking up, asking him if he was in pain. He always reported it wasn't painful. Also, the fact that he's been doing it for so long, having those wounds treated that way for such a long time, he has probably grown used to it. And due to the gravity of the condition, will this wound care permanently prevent these wounds from returning or future wounds from developing? Based on the photos I've seen on Dovetail, the wounds have actually improved. They're still pretty bad, but they have improved. Especially in the past 6 months, they used to look a lot worse. A lot more purulent drainage, and I noticed the last time we did the wound care, there was a lot less purulence coming out, so that's good. Will it prevent wounds from returning? Probably not, just given the fact that his condition, the tumor just doesn't really stop growing, and it attacks the peripheral tissue, right? So if those areas grow with the neurofibroma, there's always a chance that there will be tears in the skin, and because he is bedbound, there is a chance that he will develop pressure ulcers as well. So for my resource section, what resources can I use to help me learn? Unfortunately, the CNO or RNAO does not have specific wound care for that condition. It's a pretty rare condition. But right now, best practices are for any severe wounds. And this was with American Journal of Dermatology, that vinegar soaks are used. And according to the nurses on the unit, that's the new big thing to be doing for any type of wound care. My tutor, though, also knew how to do his wound care, so I did use Jamie's help a lot, as well as the nurses on the floor. So that's really how I learned how to do it, was just not only reading the wound care nurses' orders that they had access to, but also just asking them, making sure I was on the right course, delivering the care. The activity section, what activities will I complete to help me learn? Basically just practicing the wound care again and again. So the first time it was done, one of the nurses asked if I wanted to join in on really cool wound care. I said yes, and lo and behold, it became my learning plan. The following weeks, I was assigned to a different patient, but the nurse I was shadowing was also assigned to this patient. So I asked him if I could participate. He said yes, went over it. And then last week I was assigned to him for real. So the nurse let me do the wound care. I had help from my tutor though, but I got 3 weeks of practice doing his wound care. So it did help me feel very comfortable and a lot more competent performing the wound care. It allowed me to research more on it, learn more about his condition. Evidence. How will I demonstrate what I have learned? Well, the last week I did it after having practiced it for 3 weeks. My tutor actually came in just to give me some assistance, but she also got to observe me doing it. She let me be very independent doing the wound care. So that was kind of how I provided evidence for what I've learned, was having my tutor watch in, make sure I'm doing everything properly. So I did set my due date as November 20th. However, I feel like the last time I did it, which was November 13th, I feel like I was fairly comfortable in solidifying my learning at that point, because I did do a lot of it independently. Even though I did have help from my tutor, I still managed to do so much of it by myself. And I feel going forward in our clinical placement, if I was asked to do it by myself, I would feel totally comfortable doing it, given the fact that I've already done it 3 times. And just to reflect, well, I had no experience doing wound care clinically before this, so this was a very eye-opening experience. It was, because of how specialized it was, I learned so much. So definitely next time I'm not going to walk in and doubt myself, because I know that I know how to do this. So being a little more confident upon entering the room, because I know what the procedure is. Sure that all the supplies are there. He has very specialized types of supplies and he needs a lot of it. So I probably, next time I do it, double up on the amount of supplies I need, because we were oftentimes, actually the 3 times I did it, we were always short on supplies, and we always needed to take off our gloves, take off our gowns, get more, and then gown up and glove up, and it was just kind of a time waster. So yeah, definitely doubling up on the supplies as well. I think it has given me a very good practice for wound care, especially just cleaning wounds, understanding best practice, and not only that, but seeing a very rare condition in the clinical setting, which was, upon first glance, it was very overwhelming, not gonna lie. It was, a lot to do physically, especially because the wound care itself, save the soak, takes about an hour to do. It is a very long process, and I think having that patience and knowing that sometimes these treatments take time, and it does help exposing myself more and more to that condition, also helped me manage my emotions way more. Getting to know the patient also helped me practice therapeutic communication. So that, I think, has made a big impact in my growth as a nursing student. So thank you for coming and watching my vlog. I hope this has been a very insightful experience for you, and I hope that my learning will help other students as well.